The Test Beds programme consists of a set of NHS innovator partnerships that address key health challenges. It was set up to implement the vision of the NHS's 5-year forward view and the government's life sciences industrial strategy, and it tackles 3 common barriers to the adoption of innovation in the NHS.
We want to overcome the fact that we often don't have the right evidence around innovation. We often think about innovation in isolation, and we often don't think about how we're going to practically implement new innovation. It's fair to say that not everything that we've tested through the Test Bed programme has been effective, but there have been some really huge successes.
I was contacted one day by the clinical monitoring team who said, "We have some concern about your wife's blood pressure and we suggest that you take her to the GP." And I was able to go to the GP armed with this device which has my wife's encapsulated data history on it. That enabled the GP that day to look at the data, look at the history, prescribe the medication. So it was direct, it was fast, it was effective. This is all you want.
It's definitely given me a feeling of reassurance because I know that somebody is monitoring his health around the clock, and it's meant a lot less trips to the GP.
By collecting continuous and automated monitoring of people's activity within home, we can move towards the early detection.
So one of the main things we've gained from being in this project has been the numbers of people that's been in the trial. So actually getting the data through for those people and allowing us to use that to develop our machine learning techniques and our internal analytics has been amazing.
One of the hardest things for an SME to achieve is actually to get a foothold in the NHS. What this has allowed us to do is get a good set of evidence and outcomes, which has resulted in us getting new projects elsewhere.
Five practices have joined together in the time of the test bed, and these are practices that were really struggling for even doctors and nurses, and the telemedicine's enabled us to bring together quite a lot of quite sick patients. We've been able to monitor them remotely, so we're able to monitor so many more people.
As you can hear, I suffer with COPD, so my condition does vary a tremendous amount. So it was quite useful taking the oxygen saturation measurements every day just to get a feel for how I was doing, and it made me realise quite quickly. I could see I was going downhill before I started feeling ill, which was incredibly useful.
The Live Core hadn't really considered the route of using pharmacies before, and so we were really excited when this idea came up, and consequently at the end of the programme now we have a brand new pathway.
The speed in which a person was contacted from the community pharmacy to attend their appointment in the hospital was unheard of. Someone was contacted on the way home from community pharmacy to be invited to an appointment, which was great.
Community pharmacists have now, firstly, enhanced their reputations as clinicians on the high street. But I think the job satisfaction that pharmacists got from doing this excellent piece of work really was something quite good.
The Test Bed programme is about real-world testing, not just of combinations of innovations, but also of the testing process itself. Throughout, we've been committed to continuous learning and making changes to the things that we do as a result of that.
To innovate, you have to take risks, and with risks comes failure. But without being open to failure, without being honest about what hasn't worked, we can't learn and progress and get to service models which really deliver simultaneously for patients, for professionals, and for the wider health and care system.
I used to comment and say, well, why are we doing all this logging in? Can that be removed or lessened? And it could be, and it was. You got the sense that what you were saying was not only listened to, but acted upon.
One of the big challenges was actually just getting everything set up. We had 2 different clinical models. We had to work with industry in terms of revising clinical protocols. So what we've done is just kept working together. So I think we've had a really strong sense of team.
Our Wave 1 test beds are now thinking about how to build on and spread their innovations.
The next steps for our test bed is really to try and make it business as usual. So that's about how we get the technology commissioned across the whole of the STP area and think about how we can really embed it in clinical models.
So the next step for Tim for Dementia is to continue working on our research and to refine our product offer so that we have a solution that is more reliable and more acceptable to patients and carers.
From working on this test bed, we've learnt just how relentless you need to be to transform health and care systems. But in the process, we've also built a team and a network and a methodology for translating high potential innovations into great outcomes for people.
So based on the success of Wave 1 of the test bed programme, we're launching Wave 2. We're really pleased that both NHS England and the Office for Life Sciences have agreed to fund this programme and will be addressing a whole new load of health and care challenges.
One of the most exciting things about test beds is that it's not just what we're doing, but it's modelling how we should think about innovation. So we've done Wave 1, we've really reflected on what's worked, we've evaluated extensively both kind of locally and nationally, so we studied it. Now we're reflecting on it and acting again for Wave 2.
It's really exciting to think about how we can now take the lessons from Wave 1 to the next wave of test beds, but also think about how we can use the lessons to support local healthcare services, making sure innovation is at the heart of the future of healthcare.